Hi everyone, this is Cheryl Skolage and Kelly Maynard with another Lipedema Lite Bite. Today we're going to be talking about lipedema types and distinguishing features.
Hi, I'm Kelly Maynard from Wild Heart Wellness and getting over a little cold, so sound a little weird, but we're going to try to make it through to give you a little more information about lipedema today.
Awesome. And I'm Cheryl Skolage with Lipedema Diva. Thanks everyone for joining us. We're so excited that you're here and hope you're enjoying our little sessions here. With lipedema comes in a lot of different shapes and sizes. And so we're going to talk a little bit about the types today and some distinguishing features so that you can determine potentially if you might have lipedema. So you can see a number of different shapes in our little collage here.
I think that's a great graphic too, because it really does show some of these women, you can definitely see a classic lipedema shape, and some of them maybe not at first glance. So really good graphic.
So basically there are 5 different types of lipedema. Type 1 concentrates around the hips and the butt. Type 2 goes down to the knees.
A type 3 will be like from the waist to the ankles, excluding the feet. And then type 4 is the arms. Normally, types 4 and 5 is the calves only. Normally types 4 and 5 don't exist alone. They're usually in combination with another type. It's kind of rare for them to just, only to have lipedema in your calves or your arms.
And so some common combinations are types 2 and 4 to have the arm involvement, and types 3 and 4, which has the full legs and arm involvement. And we mentioned that it doesn't include the feet, and it also doesn't include the hands. And just a little aside, I think a lot of us have kind of a body dysmorphia, right? And, I'd always look at my hands and I'd go, well, my hands are so nice and thin. I don't have any kind of...
Correct.
Anyway. Right?
Yeah. Also a great graphic, I think. Love this one because it tells us some symptoms that you might be having that people might not notice from the outside looking in.
Yeah. Pressure pain. So any type of external pressure, an animal walking on your legs. I know when my husband used to tap my shoulder, I used to cry out in pain, and he thought I was joking. Who knew? It was lipedema.
True. I used to, when I got to a point where I knew I had to do some things, when my little child who was 3 would want to lean up against me to read a book, and it hurt so much. It's pressure pain. It sometimes, it just doesn't seem like it should hurt that much from the tiny amount of pressure that is put on you. The next, if you go down the woman's body, the next thing is sharp pain. And I love that little shark graphic right there. Hopefully it's not quite as painful as that, but a sharp pain. Some women have reported not a sort of achiness or pain with pressure, but a kind of sharp stabbing pain. And one important thing to note, because someone in our group asked this, the places where the little pictures are that describe the types of pain, that doesn't mean that that type of pain happens only in that area on the graphic. The pressure pain can happen anywhere where there's lipedema tissue, and the sharp pain is not just the hip area. It can be in other areas too.
The next item is tingling. And to me, I think that also includes almost like a burning sensation in the legs. I'm guessing that it's probably some type of nerve issue with lipedema, everything kind of tingling into the nerves there. And so it could be tingling or a burning sensation, maybe like a pins and needles type sensation, anything like that.
Right. And the last one on that side is heaviness. And a lot of women have reported their tissues just feel really heavy and maybe like they're weighted down, sort of, more than normal. And I've noticed if I'm having a day where I did too much, or I don't take care of myself, maybe I'm not hydrated, maybe I haven't done the therapies I need to do that day, my arms will just be so heavy. It feels like I can't lift them up, or kind of like you're just carrying around jugs of water or something, like really hard to lift your normal body weight.
And I noticed that my legs will have that heaviness, and I mean, the difference day to day is just amazing to me. Some days, I can go out and I can walk, a mile and a half to 3 miles, something, right now I'm down to a mile and a half, but anyway, but other days I'll be out and my legs will just feel so heavy. It's so hard to take even one step. To me, it's just amazing that it can vary that much day to day.
Yeah, and I think it's important for women to hear that, because I don't know. I can tell sometimes if I'm not taking care of myself very well, there's a difference. But also sometimes, depending on what foods I eat, or whether or not I drink enough water, or if I skip over those supplements that I know I should be taking. So if you feel more heaviness, that could be an indication that you need to look closely at how well you're taking care of yourself. If you skipped a few things for a few days, because that can be a real indicator of how you might alleviate some of that.
And actually, I kind of feel that way with a lot of these items as well, because that tingling or burning sensation, I know, at least for myself, and I know it's not the same with everyone, but for me, it's specifically egg yolks. When I eat egg yolks, I'll get that tingling, burning sensation in my legs. And I know until I started being able to move the lymph a bit through cupping and some of the other manipulation techniques, I had a lot of pressure pain. And so a lot of that has been alleviated since being able to learn some of the lipedema treatments and take care of myself better.
I think that's true. And I think some of it probably also has to do with the inflammation, because as we're moving lymph, we're alleviating some of the inflammation. And when you alleviate some of the inflammation, some of the pressure inside the tissues decreases, because we know inflammation, not just with lipedema, but inflammation with any kind of condition can lead to increased pain. And so I think there's a lot going on in our bodies, and we need to learn to, we focus so much on our outer appearance, but we need to really learn to focus on these little things that are happening in our bodies that most people can't see.
Yeah, very true. On the other side, going up, bruising easily. Of course, bruising is going to have a lot to do with vascular health. And so some of the supplements to help strengthen your veins so that they're not leaking, to strengthen those vessels, that is really important with lipedema.
Yes, and I want to say, you told me a story about bruising easily when your cat walks across your leg. I was just blown away by that. It's like, that can't happen. But you told me that you actually had paw print bruises.
Yep. Yeah, this was a number of years ago, but I had paw print bruises up the back of my legs. And at the time I was going to curves, and I had, my little shorts on, and they were on the back of my legs. So I didn't think anything of it, right? And I'm there exercising, and the girl just kept looking at me, and I'm going, what's going on, right? And she's looking and looking, and I'm going, am I, hanging out somewhere? And she, after I finished my workout, she said something about the bruises on my legs, and I was like, bruises? What bruises? And I went, oh, it was my cat. And she's looking at me like I'm crazy. I really think that she thought maybe I was being abused at home. And I don't know. I'm thinking she might be ready to call the leaps. Anyway, so that's my story about bruising.
I also have noticed I don't bruise very easily, but when I bruise, it is much more of a serious looking bruise than it should be for whatever happened to me. And it takes longer for that bruise to go away.
Yeah, and heal. Yep.
So I think any kind of abnormal bruising pattern might be a symptom of our tissues not being as healthy as they need to be, and our veins. The next one is orange peel. And we had a woman ask in our group about the orange peel. So this is an appearance of the skin that looks like the surface of an orange. So like not smooth skin, but little denty looking skin with little pits in it where the underlying connective tissue is distorted due to the lipedema affecting the connective tissue. The question in our group was, well, what if my skin feels like orange peel? So I did want to clarify when we got to this point, if your skin feels like an orange peel rather than skin, that's not what we're talking about. And that is probably something that you need to check with a dermatologist, because lipedema, the appearance may look like orange peel, but your skin should still feel like skin. So if it has a weird rubbery texture like an orange peel, that's not what this means exactly.
Good point. I didn't realize that. Good to know. And at the top, we're talking about a big difference in size. And so in particular, waist to hip measurement, a large difference. Often the upper body will be a couple dress sizes smaller than the lower body. Sometimes that's hard to comprehend because the arms can get so large that since you're trying to fit the arms, you don't realize that the upper body itself, it might be a smaller size than your bottom.
That's true. And if you notice on the picture, her arm from her elbow to her fingertips is quite a bit smaller than her upper arm. That's really common as well, if you see a big difference there.
Yes, yep, very true. So going over some additional distinguishing factors, and pictures like these have just come out really recently, but they're starting to notice various things. Well, the ankle cuff, so the first picture is kind of common. That one's been known for a while. And so it will look like your leg suddenly stops and there's a cuff before the foot. And typically, well, in lipedema, the foot is spared from swelling. If your foot is also swelling, then you could still have lipedema, but you would also be looking at lymphedema if your foot is swelling as well. And then they would have to backtrack a little bit and determine if it's only lymphedema you have, or if it's both lipedema and lymphedema, if that makes sense.
Correct. I think it makes sense. It's hard. It's kind of hard to get the lymphedema and the lipedema sorted out in your mind sometimes. But I think sometimes women who carry a little bit of weight in addition to the lipedema, their feet might seem a little bit larger, but it's not the same like fluid swelling as what we're talking about here. So the second picture is fat pads around the ankle. If you notice that picture, there's a little bump on the side of the ankle. It almost is like your bone, that your ankle bone is covered by a little blob of fat tissue. So most women with lipedema, you won't really see definition of their ankle, where the ankle bone should be. That's on the inner and the outer ankle. If you look on the last picture, you can see a little bump on the inside of that ankle as well.
Mm-hmm. And also wanted to mention that we obtained these pictures from Dr. McHutchinson's article. So we do have that there. the previous picture was from FC Lipedema on Instagram. She is a wonderful lipedema artist. Go check her out. And the collage was from Nikki Gregory with Lipedema Warriors. So just wanted to make sure that we got all of those out there for you to know that those were where the pictures came from. All right, sorry.
No, we need to give credit to all those people who did put all that together for us. It's great. All right, Samara Sign, we talked about in a previous video, but this is the picture from Dr. Samara in Spain. He is demonstrating where you should put pressure on your leg to see if Samara Sign is positive for you. So if you push on that little spot where his thumb is, it doesn't have to even be a significant amount of pressure, but constant pressure, then it should hurt quite a lot. Sometimes a very sharp pain if you push on that area. And if you push with the same pressure on a different area, even a lipedema area, it doesn't hurt in the same way.
And I found one of the very interesting things is that he has found, even with stage 1 women, that this is a positive sign. And so he can determine whether someone has lipedema or not through this particular location.
Yeah, and if stage 1 women can use this helpful tool, we might be able to do some earlier detection. And Dr. Samara does say pain in that area alone is not a diagnosis, but he has found a correlation with women who have lipedema and pain in that area with pressure.
Interesting. There's some fat pads around the knee, so you might be able to observe these on yourself to have an idea if you have lipedema as well. A fat pad on the outer and inner side of, the outer side of the upper knee, inner side of the lower knee, and then potential fat pads behind the knee as well. I know that I've had that number 2 fat pad for quite a while, and I think it might be going away. I'm very excited. Yay! But yeah, it's really interesting just to have this fluid area on top of the calf right there. So that's my thing.
And in that area, this number 2 area, I think women notice number 1 and number 3. Number 1, okay, that's confusing now. I think women notice behind their knees and around their knee because they can't see their kneecap. And obviously, if you have something behind your knee that may be inhibiting you from like bending your knee or something, you'll notice that. But that number 2 area on that inside, under your knee, beside your shin, I don't know if a lot of women really look at that area for lipedema. I've had that area too, and I've been working on it quite a bit with cupping and gua sha and things like that. But when I first started out, that area felt like bone. It was so hard.
Oh, really?
I couldn't push it at all. It's very painful. And it's softening up now. And I have lost some circumference around my calf from working on that tissue. But if you look at your leg right there, it'll just be a bump where there didn't used to be a bump. And it may not feel like fat. It may feel, it's fibrotic, so it may feel hardened, not just fat. Sometimes lipedema fat is not squishy and fatty like you would think. It's the tissue changes, and that means that it is less healthy than it was before.
Yep. I know my calf, I always thought it was the calf muscle.
Right.
That was really, really hard and fibrotic. And just over the past maybe year, it's loosened up quite a bit.
Yeah.
So it's interesting because you don't realize it until it changes. And then you go, oh, wow, that was really hard. That wasn't right.
That's true. And I didn't think about how parts of my body were so hardened until I saw a video of an athlete who was getting a massage when I was watching a video for some sort of connective tissue therapy. And they're even really high level athletes, their muscles are loose. When you're watching them get massaged, their tissues are malleable and they're soft. Of course, when when you're watching an athlete, you can see their muscle definition and it looks like their muscles are hard, but that's only when they're flexed. So this hardened tissue around the muscles, around the fat cells, that is not a normal condition. And that's part of what we're trying to work on when we do connective tissue therapies, is to break down those abnormal tissues and soften them up.
It's such a great point, because I think none of us realize, because it's our own body, so that's the way it is, right? So you don't understand that it's not quite the way that it's supposed to be. So yeah. This particular graphic is from Danielle Lipedema Chile. He's also on Instagram, therapist, and he's been collecting some profiles of lipedema ladies. And you can see, again, just like our first graphic, how different each lipedema patient is. The fat can collect around the hips, can collect through the whole legs, the thighs, can have just a column type leg, can have saddlebags, a lot of different expressions for lipedema.
That's true. And I think it's important to just note these silhouettes, and also the first graphic that we showed, these are actual silhouettes of women who have lipedema. These aren't drawings of somebody's idea of what lipedema looks like in different women. These are actually, they took pictures of women and then made silhouettes out of the actual pictures. So this is a really good representation to show all the different ways that real women look who have this disease.
And as always, for more information, you can contact me at lipedemadeva.com.
And my website is wildpart.health, and email is info@wildpart.health. And then the groups.
We also have 2 Facebook groups. So for patients, we have Lipedema and Food Sensitivities, Take Control of Your Lipedema. And for providers, health and wellness providers, we're looking for you to spread the word.